Hello, friends. This is Chandrakant from Akulmach, and welcome to Dr. Speak. And today we would like to discuss something very, very important, and it's around the obesity among people. To discuss this further, let me invite my friend from Shimla, Dr. Pooja Bedi.
Good morning, CK. It's a pleasure to meet you again.
It is our pleasure, and as you can see that we are in the plains. I'm in Delhi, and it's
Yes,
quite hot here. Temperature is already touched, but I think you are enjoying your uh, you know cool weather there in Shimla.
yes, absolutely. It's very, very pleasant, and we are still in sweaters, but it's a very pleasant weather here.
Great. So, doctor, obesity is the subject for today's discussion, and people tend to do a lot of Google around this subject, and they discuss about body mass index. I think there has to be a little bit more clarity given. And my question to you is that you can explain to our viewers what is the obesity and what does it mean in the first place?
Yes. It's a very excellent topic actually to discuss about CK. So, I would like to start with one liner that obesity has to go beyond the, cosmetic factor. It is more or less presently considered under the cosmetology or cosmetic field, where we are more concerned about how we are looking in spite of how it is affecting our health. So, obesity, in very simple terms, is the overweight or over accumulation of the fat in the body. As you very correctly mentioned, that we actually Google and try to calculate our BMI or body mass index with the help of the calculators that are available online. So it's a good check. To be very frank, it's a very good check. If you're somebody is around 30, if the BMI is around 30, depending on the age and the comorbidity factors, it is actually an alarming situation where it tells you that we are, proceeding towards the obesity. So obesity is a kind of a syndrome. It's not a single thing that is existing. There are many multi-level physiological effects that comes along with the obesity. To start with, you will not believe that stress and anxiety can lead to obesity to a greater extent. If you look at the people who are undergoing schizophrenic treatment or any other mental issue treatment, they tend to overeat, and the treatment in itself can lead to obesity. So, this particular thing is to be ruled out, especially in the COVID era, where the mobility has decreased and the morbidity in terms of obesity has increased a lot. So, this is such a crucial syndrome, I would say, because it is a multi-dimensional thing which affects the body. It needs to be ruled out. People who are not familiar with too much of medical information, body mass index is the first indicator where you simply divide your weight with the height. So you get to know ki where I am standing. So if somebody calculates it, will get to know that 50% or more than that people are suffering from childhood, age related, disease related, genetic related obesity. So it has got such a multi-dimensional faces to it that in spite of people doing exercise but not sticking to it on regular basis is actually more bad as compared to having a overweight situation. So we if we keep on saying that I will do the exercise for some time, then we relax. For some reason, we just avoid it. It can be a medical reason as well. But there are way out where we can control the nibbling habit or that urge for the excess amount of food. So we have to maintain some kind of calendar where we can rule out what is going wrong, where it is going wrong, from where it is coming, and how to deal with it. So, if I may add, please, ki how it actually affects the different physiological functions. Obese people, depending upon their age factor, especially in the middle age group, it can affect the heart very, very tremendously. It can lead to early onset of the hypertension in people. Ideally, considering all the environmental and the hereditary factors, the hypertension, especially hypertension, tends to come after 50 years or 55. But because of these pre-existing factors and the COVID, you know, these are all adding on to the pre-exposure to the hypertension or heart-related disorders. There are many, many other things that can actually pop up along with the obesity. So it's a, you can say, a causal factor for many other major factors that can affect a person's health. So it's very important to be in a good check regarding the weight and the kind of activities that are required to be done.
Doctor, I think you have explained this quite nicely in terms of people to understand what is the meaning of obesity. It's basically becoming little overweight, and the BMI or body mass index is a good measure to check whether you are overweight or not. So I think that that's the first indicator. Uh, like a middle-aged, many other middle-aged men, I'm also one of them, and I can throw myself as the guinea pig in this discussion. Um, I was 92 and my height is 5'8". My BMI was quite bad, but when you go to the professional BMI calculators, then I was not obese because I was doing a lot of gymming and all that. So even though my weight was more, it was more of a muscle mass. But I was very conscious, and when I tried to reduce, it was not happening. I use all methods, running, jogging, and stepping, and all those kind of things. It did not help me. So a couple of years back, more than 5 years back, I decided to, and there was a time limitation also, doctor, because to do exercise, you need to basically find that specific time from your busy schedule, and then do that, and that was a luxury. So what I decided is I started cycling, and it's not usually going in the morning cycling. I actually started going to office, going to work on a
Hmm.
cycle, and that was like a 20 kilometers ride every day for 5 days. And gradually what I've seen is that over last 4 or 5 years, and very gradually, it's not something which has happened overnight, uh, I've lost something like 17 kgs. Now my weight is 77, and I'm quite happy, because even though I was not obese as per the professional BMI calculators, not the usual weight related BMI calculator, but if you go to any hospital today, they can use radio waves to check out how much is your
Yes.
fat, how much is your muscle mass, and how much other things, water content, etc. So I'm quite happy. I've reduced by doing cycling and changing my lifestyle. So my question is to you is, as a professional, is that there are many people like me, but they are not doing exercises or rather merging exercises in their daily routine, and
Hmm.
going to a gym sometimes is not practical, simply because I was going to gym regularly, but then I used to go for 1 hour, and then it became 1.5 hours, and then eventually it became 2.5 hours, because half the time you spend in chit chatting with your friends, and most of the gymmers will be from your industry. So it is a lot of waste of time. So I stopped going,
Yes.
and I just went on I bought a beautiful cycle, which was suitable for me, and I started going to the office, and that really helped me. So the question really is that how people can adjust their lifestyle so that they don't get obese, because not everybody would like to do cycling like I did.
Yes.
Some people may have limitations, people may be not very comfortable, and things like that. So what you will advise those type of people?
See, CK, I also fall into your category where time is actually a constraint. But going to gym, first part, as you have yourself answered the question that you are able to manage it by doing the cycling, which is very good. Now, coming to the initial part where you mentioned where your BMI was onto a good check, your muscle mass was more. It happens with the athletes also. So there's the total different perspective to it, the way you have added to it. So if the athletes, if we go for their BMI, which is going to be towards a very high critical obese factor, so but there are other factors that are required to be worked upon. So they require that much because they are into this particular profession. Uh, Now coming to, we don't have the facility either going to the gym. If this is the factor, all we need is just a yoga mat, not more than that, and that much space is fair enough to do the exercise for 30 to 40 minutes. I'm not recommending go for 1 hour, but 30 to 40 odd minutes of mild yoga will change your body entirely in a modest form to an extent where the other factors of the obesity will not affect. And I don't recommend people to undergo weight loss tremendously and randomly. It has to be a gradual, slow process where your body adapts to it. The only trick or the mantra is that you have to keep doing it. You have to stick to a schedule that you have to follow. As I mentioned, all we need is a yoga mat. You know, just do the yoga for 30 to 40 minutes in case somebody is not able to join the gym and wasting the travel time as well. So that travel time can be somehow compensated into just doing the mild exercises at home. And sooner or later, combining the other environmental as well as taking a check on your dietary plan, or you can make a planner for yourself. I can assure you, if there are no hormonal and the morbidity factors causing the obesity, it will cure itself. Obesity will go itself. I don't recommend people to undergo size zero. It is not required. You need weight. You need that much of fat in your body, which you can compensate as we proceed age wise. So it is highly recommended that you just need to have a yoga mat. And to be very frank, during this COVID particular time, people are actually uh, going for cycling a lot. I am in Shimla presently. I am from Delhi. But to be very frank, at both the places, I've never seen people doing cycling in my colony in Delhi. But during this COVID time, last year we went there and I saw, you just don't mention the age group, people from kids to 50s, they are doing the cycling inside the colony where they were not actually finding the time to do the walk as well. They said it's a congested area, but they're doing it now. So it's a very good factor that people are getting aware that we can utilize the time for doing the exercise either by going to the office very smartly as you are doing. In case they are not able to do, just the yoga mat will suffice the need, but you need to be on it regularly. That is a first thing to it. But yes, you have to consider the other factors for sure, like diet and the other factors. I always recommend whosoever walks into my clinic regarding to obesity to first make a planner. When somebody feels like eating more, what kind of food you are eating at that particular time, what are your cravings, and more or less the genetic also influence, has got some kind of influence on the obesity. Influence inherit, I'm not saying inheritance, that's very clear. If it's a gene, it will definitely go along with it. So we tend to see the generations having the obesity issue, but the influences as well, the kind of cooking the family people are doing, we tend to get influenced into same eating habits and exercise habits. I mean, if they are not doing it. So this is very crucial. So if somebody has time constraint, or you can say money constraint as well, going to the gym is quite expensive these days. All you need is simple yoga mat. If you're not towards the extreme obesity, if it is on the milder side, say let's say if it is crossing 30 and between 40, you can easily manage at your own level considering the diet as well as the exercise, but you have to be very consistent.
So, doctor, I think you're talking about now creating a routine so that your obesity could be brought under a check. And as you have also explained very nicely, that it's not a one day affair. You can't go on a crash diet and reduce 15 kgs in 1 month. That is not advisable at all. So, that brings me to a question which is related to motivation. For example, I found a motivation in cycling. riding 20 kilometers, and it required a lot of mental makeup, calculations, which route I will take, what is safest one, what time of the day, how to equip my cycle, whether I should have a light, how do I carry my laptop, things like that, and how do I change. So there are a lot of planning went into my routine change, my lifestyle change. And I found that it was not an easy decision from migrating from a car, wearing a suit and a tie, going on a
Yes,
bicycle where you're just dressed up in your track suits,
yes.
bicycling suits. So it requires a lot of motivation changes. And you mentioned about yoga. Some people may not be motivated to do yoga. So I think the
Yes.
question is, in order to check your obesity, how do you motivate yourself? I mean, that is the biggest question. People have cravings, they want to eat chocolate, they want to eat something, but they also want to reduce weight. How they motivate themselves to do routine change?
That's a very good question, CK, I must say. See, either somebody wants a life threatening disease to be a motivation. Some people, many of the people, in fact, when they have some kind of very threatening heart issues, stroke, or many others, fatty liver disease, or something related to it, then that sets a kind of a motivation for them to lose weight, which is actually incorrect. To be very frank, I don't promote such kind of motivation, but it's more or less of a demand. This is what your body is demanding now, and you have to give it back to it. So for some people who doesn't want to undergo this kind of disease or morbidity, this actually works as a motivation for them to get into a very good healthy lifestyle and getting their summer body back, or you can say weight loss, getting out of the obesity. So that is one factor where disease is a kind of a motivation, you know, ironically. But to be very frank, for somebody who is proceeding still in a way to get into some kind of threatening disorder or diseases later on, the motivation simply has to come from inside only. If you take simple example, if there's a family of 5 people and they have a genetically or you can say inheritance of the obesity, so and one odd person is there who is not on a obese side, it should not be a familiar inheritance that one should be very proud of. So all you can do is that if you are in a good check, then be better stay in the same shape. So, like in my family, many of the people are obese. I am on the thinner side, and now I am on the ideal weight side. So, it is entirely up to you how you motivate yourself. The third point, which is so crucial, CK, these days, is the cosmetic value of the obesity. It again ironically plays a very good role where people wants to look cosmetically very good. You know, which gives them a confidence. If you're looking good, if you're dressed nicely, you are able to talk very confidently. Uh, these kind of things do happen when people are keeping a check, uh, you know, and getting themselves motivated. So somehow, when you do some kind of exercise, it always motivate you to stay in shape. So that is a third factor. Fourth is the mental health, which is such a crucial when it comes to obesity. The moment one person starts to lose little bit of weight, you will see there's a sudden change in the glow of the skin that comes. It suddenly gives a push to the confidence in that particular person. Now this confidence actually is in itself a motivation that I want to stay fit, I want to be healthy for many coming years. So that is a motivation for them. So there are different ironical factors which works as motivation, and there are other factors that comes along with you say peer pressure, economical, environmental factors that play crucial role in losing weight or having a motivation.
So, doctor, there are a lot of high tech equipment available right now. People tend to see these in Amazon, and there are a lot of advertisement also happening on the TV where say that, hey, wear this belt 10 minutes every day and you lose 10 kgs. how true or these advertisements are, basically, from your point of view? What do you feel about these things?
I just completely don't endorse these kind of products at all. The best way to, because you are well aware of your own body. You know, if I lose 5 kg, I tend to develop the low blood pressure. It happens in many of the people, and then they tend to eat more just to gain their, weight, so that their blood pressure is maintained. I'm just citing one small example. I don't endorse these products at all. Going for a walk, if one can afford to. If not, then do simple 30-40 minutes of yoga, depending on the kind of disorders one is already having. And for mental health cases, they can actually approach the counseling centers. They have a very good obesity management program going on, intensive obesity management programs, which really helps. But going for, if we are mentally prepared to spend from 1,000 to 40,000 on equipments, and we are getting free oxygen outside going for a walk, then why not a simple walk? And a yoga mat, which is of 100 bucks, and just putting own effort for 30 to 40 minutes. Uh, I really endorse this particular thing where we are making the effort. Effort is something which we value ultimately, and we get a motivation for it, to be very frank. And if people are using these kind of equipments, you will see how they endorse their products, that you can, you can spend more on screen, which is such a uh, bad habit they are actually telling people to inculcate. Screen time can actually increase your body weight. So wearing a belt and then sitting and watching TV, I'll not recommend. But people who are undergoing age process, and along with it osteoarthritis and these kind of things are coming, then also I'm not recommending. I don't endorse these products. Better way is to plan your diet in a manner, and milder exercises where you are making your body to work out. So I don't endorse. You have to sweat it out. You have to do it on your own and keep it, let it go on for a good long time or maybe forever. It really helps.
So the last question, doctor, is about the pills. There are a lot of pills being advertised along with these belts. I don't want to make any brand name here, but I think we all know that there are pills available. You pop one every day, and then you lose 10 to 15 kgs in a month. What do you feel about those medications?
I don't completely. I'm very against all those pills. It's better to undergo some kind of diet plan that I can still endorse for, but not the pills. Pills are not a solution, and people are actually undergoing some kind of surgery process also to lose it instantly. When we have gained it gradually, why do we want to lose it instantly? So this mind has set has to come up. When it has come gradually, it cannot go randomly. So better to undergo some kind of diet plan that I definitely endorse. If somebody wants to have a, some particular kind of GM diet or some other diet, so diet plan is still better depending on your body, BMI, and other factors, but not the pills. Pills are not a solution. You cannot lose weight overnight, as you correctly mentioned previously. So it cannot happen overnight or in a couple of weeks. You have to keep on working very hard for it. And once you start losing it, then it becomes a habit, to be very frank. So you have to have a strong willpower. I want to do it consistently. I want to stay healthy. I don't want to waste my money on getting medical treatments later on. Maybe I can buy a Ferrari with that cash. But so somebody has to get some kind of motivation to stay in check.
Excellent conversation, doctor. In fact, the key learning from this conversation is that there is no substitute to exercise, to keep your weight in check, and remain healthy for your life. So thank you so much for giving all these tips to our viewers and to me personally.
Pleasure, CK. It's always a pleasure.
So we will catch up with you next week again on something very interesting. Until then, bye bye.
Bye bye.